Welcome back. We're continuing to discuss your health on our show for this Wednesday. Right now, specifically back pain and lower back pain. There's actually a national awareness campaign called Know Your Backstory, because back pain can be integral in overall health and affects everything. Today, Dr. Denis Patterson joining us and Lee Davis, one of his patients, to talk about this. So grateful they're both here to talk about this. Dr. Patterson, what do we need to know about lower back pain?
God, it's a debilitating condition in the United States. A quarter of all adults have it, or 72 million Americans. And unfortunately, 27 million Americans never really know the cause of their lower back pain. And that's why we started this national ad campaign, because 85% of patients can have an enlarged ligament that can cause the pain. And now we've got some good treatment options to take care of it.
And I love the name, Know Your Back Story, of this awareness campaign. Tell me more about it.
Oh, God, the campaign is a national health awareness to get people to understand that there is this enlarged ligament that can cause chronic lower back pain, and that there are simple, easy treatments to take care of it. As we were saying, that when we did a Harris poll, we found that 78% of Americans did not know that this ligament existed, and that when it became enlarged, caused their pain.
And there's some common misconceptions about lower back pain that interfere with this. Tell me more.
Oh, God, the common misconception is that it's something that you have to coexist with, and that there's not many good treatment options out there. And I think, unfortunately, with the opioid epidemic, we've seen that in the past, we try to throw medications at the problem, and the problem didn't go away. If anything, it got worse and caused another, epidemic in the United States of overdoses with taking those types of meds.
And Lee, thank you so much for being here and sharing your story. Tell us more about your experience with back pain and how it affected your life.
Well, I could tell you this much. Getting the mild procedure was one of the best choices I made in my life, because prior to that, I had 2 back surgeries, and 23 years later, I was still living with chronic pain. And I was one of those stubborn ones. I wouldn't let them push drugs on me, the pain medication. So I had a doctor that was a very conscientious and patient-friendly doctor that recommended me to a pain specialist. And that's where I met Dr. Patterson. And then he turned me on to introduced, I should say, the mild procedure to me, suggested it to me. And then I went ahead and went with that. And like I said before, it was one of the best choices I made in my life.
And how has your life changed since you had this procedure, Lee?
Well, after receiving the mild procedure, several days later, I was married. I was able to stand at the altar and sing to my wife with a smile on my face. I wasn't there in agony. And standing at the altar, your knees could tremble a little bit. At least I knew I wasn't going to fall down from the pain and the discomfort, thanks to the procedure. And I was able to get married and be a happy person.
Well, congratulations. Just an incredible story. Dr. Patterson, what was your takeaway from Lee's particular case, and what can we learn from it?
Oh, I think that you need to know that traditional treatment that you'd think of with medications, physical therapy, and epidurals, we found that majority of patients didn't improve with that. Just know that there are new treatment options out there, including this mild procedure, which can transform or change your life. And I think that's what people need to know, is they need to look into this, question their doctors and physicians, or bring it up. And hopefully our campaign will raise awareness that people become more aware of this procedure and pursue it, having it done if they're a candidate.
Yeah.
And Lee, what's your advice to someone who may be having pain and they might be a candidate for this procedure, but maybe they're feeling a little anxious or unsure?
Well, my advice to them is to know that it's minimally invasive. I mean, it's just like getting a little cut and you recover. All you have to do is keep the bandage dry. And then 2 days later, or some people recover even faster than that, a day later, they're back to normal activity. And that's how it was for me. And I would recommend it because it's way better than having the medication regimen placed on you or some of the invasive procedures done. It's the best for me anyway.
And Dr. Patterson, mobility, overall health and wellness makes such a difference. Where can we find more information about everything we've talked about today?
I'd recommend that you go to knowyourbackstory.com. That website's got a lot of useful information there. It goes over spinal stenosis. It'll tell you about more of the signs and symptoms of the condition and just kind of give you a better background on it. The other part, it goes through different treatment options, including the mild procedures. So it's a really good resource to know more about the condition and the treatment options out there. But what I really want to highlight is that it has a find a doctor search engine. So you can put in your zip code, and it can tell you a provider in your area that specializes in lumbar spinal stenosis and knows about the mild procedure, and you can contact their office and get a consultation to see if the procedure is right for you.
Well, thank you so much, Dr. Denis G. Patterson, for speaking with us today. Really appreciate this important information about back pain and this campaign, Know Your Backstory. And thank you so much, Lee, for sharing your personal story with us. We'll be back with more right after this.